Hello, my name is Mike Durracq, and I'm very pleased to have the opportunity to present data from our research project. My co-author Stephen Thornton and I are board-certified emergency medicine and medical toxicology providers in clinical practice. I'm also board-certified in addiction medicine. By way of background, our project stems from the ongoing U.S. opioid epidemic. You can see some statistics on this slide that are particularly concerning, describing ongoing deaths and problems related to opioid use in the United States. Buprenorphine is an opioid agonist medication that's been used in the treatment of pain since 1981. In 2002, the U.S. Food and Drug Administration approved buprenorphine for treatment of opioid use disorders. Buprenorphine is a potential option for patients, however, others are also available, including methadone. Advocates of buprenorphine describe buprenorphine having particular pharmacological features that make it more favorable as compared to methadone. And some sources even go so far as to describe no risk of respiratory depression even at high oral doses of buprenorphine. However, respiratory depression and death are still listed as potential side effects or clinical outcomes when buprenorphine is taken alone or in combination. This information is found from FDA package inserts, the physician's desk reference, the US SAMHSA website, and individual state public health epidemiologic reports. The purpose of the present study was to evaluate the characteristics of single and multiple substance MOUD approved buprenorphine oral exposures as reported to the National Poison Database System between 2003 and 2019. We looked specifically at medical outcomes and the frequency of respiratory depression, intubation, and naloxone administration amongst those cases. The National Poison Database System is the database of the U.S. Poison Control System, representing 55 distinct centers. Data is uploaded every 9 minutes, and it represents the largest repository of U.S. exposures and poisoning and management available. We looked at cases recorded between January 1st, 2003 and December 31st of 2019. All cases involving a product code that is approved for MOUD were examined. We were most concerned about oral exposures, as this is the route in which buprenorphine for OUD is administered. Pediatric and adult cases as defined by the NPDS, and then cases followed to a known outcome were analyzed. The NPDS describes specific medical outcomes, as you can see here. Respiratory depression also has a specific definition according to the NPDS. We were interested in cases in which naloxone or intubation were recorded as having been performed or recommended by Poison Center staff and subsequently performed. 27,275 cases were identified and followed to a known outcome. The present graph describes visually the temporal trends in exposures between 2003 and 2019 for single, multiple, and all exposures. This represents a 65-fold increase in the total number of exposures between 2003 and 2019. In terms of clinical outcomes, you can see those listed here. MMD in the last column represents more serious outcomes such as moderate effect, major effect, or death. This graph also describes visually kind of the trend in those more serious outcomes over time. And in both pediatric and adult patients, there's a trend to more serious outcomes. We identified a higher frequency of more serious outcome in multiple over single substance and adult over pediatric patients, as well as that increasing frequency of more serious outcomes in adult and pediatric patients over the study interval. In terms of the clinical effects that were previously described, you can see the frequencies of those listed here. We identified no statistically significant difference in the frequency of respiratory depression in adult versus pediatric patients overall, as well as no statistically significant difference between single and multiple substance adult or single and multiple substance pediatric exposures. A higher frequency of intubation in multiple over single substance and adult over pediatric patients were identified, as well as a higher frequency of naloxone in multiple over single substance and pediatric over adult patients. By way of conclusions, we identified an increasing frequency of exposures to buprenorphine between 2003 and 2019, as well as an increasing frequency of more serious exposures over that same interval. There was an equal rate of respiratory depression between adult and pediatric patients, as well as single and multiple substance exposures, as well as within the adult or pediatric age group between a single and multiple substance exposure. This raises the concern that the safety of buprenorphine for opioid use disorder may be overstated. Thank you.